Hi, I'm Melissa Bantug in the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined by Carol Riley. She's a nurse practitioner in our Survivorship Program. Hi Carol, it's great to have you here.
Hi, thank you for inviting me.
Can you tell me a little bit about some of the things you hear from patients at the end of treatment, some common side effects that they complain about?
Yes, there are a number of side effects that are quite common with our survivors. Sometimes it's very helpful for patients to know that a lot of these side effects are common. That can be very helpful. Fatigue is a very common side effect that we hear that can start, immediately and last weeks to months after treatment. And it can be very frustrating for women at the end of treatment to be, wishing that they were feeling better and they're not. We hear a lot about menopausal symptoms. Women with treatment are thrust into menopause, and so they're having hot flashes and some vaginal changes that can be very challenging for them. We often hear a lot about changes in libido, and certainly fear of recurrence is a really common side effect that women really struggle with after treatment.
One of the things we do here at Johns Hopkins is that patients are offered the opportunity to have a treatment summary and a survivorship care plan at the end of the visit. Can you tell me a little bit about how that visit goes and what's done during that time?
Yeah, so it's a lengthy visit, and our survivors will sit down with myself or some of the other nurse practitioners in our survivor program, and I generally start with a questionnaire, a survey, where women can evaluate their symptoms, side effects, anything that they're experiencing left over from treatment. And then we address those side effects and symptoms. We talk about ways to manage them, strategies to help deal with those side effects. Then we talk about the follow-up plan. Who's going to be seeing the patients when? Who's going to be ordering the tests? What tests will be done? And at the end of the visit, I develop a survivorship care plan. The patients actually walk out the door with in hand, and it summarizes all of their treatment, everything that they've had, follow-up care that we recommend. We outline any strategies that we have identified to address their concerns and their side effects, and then we outline the overall plan in terms of who's going to be seeing patients when. This way the patients can walk out with this in hand. They can make copies of it and give it to their gynecologist, their primary care doctor, so that everyone is on board and they know who's going to be seeing patients, and they can help support our plan as well.
That sounds like a really great tool. Do you find that that's helpful to help coordinate care between all these different providers that the patient may be seeing?
Yeah, absolutely. During the treatment plan, the primary care doctor, the gynecologist, any referring physicians receive our notes on a weekly or bi-weekly basis, depending on how often they come in. But that can be stretched over many months, and so it can be difficult for PCPs to really keep track of what's going on over many months and 30 different notes. So this is just a one-page summary that really can help us stay connected. They know what our plan is. They can help support that plan. Plus it has our contact number so we can easily be in touch with each other if there are any issues that come up.
It sounds like it's a really helpful tool to make sure that everybody's on the same page as the patient goes from active treatment to long-term survivorship.
Yes, absolutely.
Are there other lifestyle suggestions that you recommend for patients in terms of diet or exercise or lifestyle things?
Yeah, certainly there are a lot of things that we recommend. Certainly, exercise. We recommend that women get 30 to 45 minutes of vigorous exercise 5 days a week. That should include weight training as well to help support the bones and prevent bone loss and osteoporosis, which can come along with some of the treatments that we give. A heart-healthy diet. There's no specific breast cancer diet or cancer diet, but certainly a heart-healthy diet is what we recommend. There could be supplementations that we may recommend, and that will depend on the patient and their individual needs. And we recommend limiting alcohol, getting exercise, and just in general getting enough sleep and taking good care of themselves.
Well, this has been really helpful. Thank you so much for all this helpful information. I really appreciate you joining us today.
Thank you for having me.
Thank you so much for tuning in today.